since I started in council 3 years ago, I've been measuring some of the social strategy outcomes. So you can see on the left we've got 4 outcomes or goal areas: safe and healthy communities, resilient and engaged communities, culture, heritage and diversity are valued and embraced, and people and places are connected. And for each of these outcome areas we have social strategy targets. So for example, for safe and healthy communities, the target for that is to maintain our #1 ranking as the healthiest region in Queensland. And that's because we recognise that regular physical activity and healthy eating reduces the burden of chronic disease in the community. So a really important reason and an outcome. The challenge in measurement that I've found over the period of a number of years in doing this is that we didn't really have, I guess, an insight from our quite successful Healthy Sunshine Coast program that attracts about 6,000 people to free and low-cost health and physical activities each year. We couldn't really, I guess, differentiate from the Chief Health Officer's report of the most healthy region in Queensland what part our program contributed to that. So we had issues of attribution there. So we couldn't actually, while we knew anecdotally that people were really enjoying the program, particularly that it was low cost, we didn't know to what extent people were maintaining those healthy lifestyles. Were they changing their eating habits? And 6 months on, was this making a difference and impact in their life? So that was one of the challenges there. Also, for culture, heritage and diversity, our target there was to increase the frequency our population attends council major venues, public facilities, aquatic facilities, libraries, galleries and events. But we didn't have any insight, although we had a number of people who were attending there, and that was increasing year by year. It didn't tell us what they were benefiting from the presence of that social infrastructure. Were they connecting with other people? Were they using the free computers in order to access job opportunities and the like? So we didn't have any direct insight into that. And so we began to look towards social impact measurement as a way that we might understand that a lot better. One of the things that was important, because we had, I guess, these quantitative measures that told us about volumes, we complemented this with a series of case study videos. So we had the qualitative stories about what people had found. And we found that really useful to find the balance. So we would ask community organisations to speak to the difference that it made and what the social strategy actually enabled for them. And so that was really valuable. There was also issues of data availability and time lag because for the healthiest region in Queensland and for the volunteering target, we were relying on really good primary data, but the Chief Health Officer report comes out every 2 years and volunteering is based on census statistics, which is every 5 years. So we couldn't actually have an understanding in that intercensal period of how we're tracking, which was really important. And so these were a lot of reasons behind why we were very interested in moving towards social impact measurement. But there was also another range of other catalysts for change. So about 12 months ago, we had an organisational change, and our community planning and development team came together with our economic development team. And while at face value that probably doesn't sound all that significant, what it does actually show is that there is, I guess, a growing sophistication and understanding around the importance of an integrated approach to how we understand community. And we understand that, you know, economic imperatives, if, you know, people can't get jobs or there's downturn in the community, has repercussions for the community as well. And so these are deeply complex, nested systems that require really sophisticated ways of understanding and to address them in really clever, integrated ways. But there was also broader challenges around, you know, the community sector. So we're seeing a range of funding changes and reform agendas. So in the aged care sector, My Aged Care, NDIS is going to be rolled out in January of next year. And so the funding's changing, and so, you know, there's a growing sophistication and growth as well in the community sector. The health and community services sector is in fact our largest sector on the coast, employing over 19,000, so 15% of our population, so a really big sector for us as well on the coast. But also the roles of state and federal government as well. Where does council fit in that? Where does local government fit? And also the desire to really support and partner, not compete with community organisations for, you know, those finite funds. So we came to, I guess, all of those factors to say, how can we as local government best add value in this space? And so our journey towards this new social strategy has started a couple of things. So we've been doing a deep dive into best practice. So we've looked locally, nationally, internationally around, you know, what other people are doing in this social space. How are they measuring social impact? How are they structuring the strategy? And we've also done some benchmarking around a range of those factors. We're examining the strategic frameworks and the pathways to move more towards that social impact measurement. And so as Mel alluded to earlier, we're definitely in that really the first phase, the design phase now. But also a desire to really better our community engagement approach. And so our CEO is very keen on looking at how, what excellence and engagement looks like, and getting the community involved and actually getting the community to guide what that vision for the future looks like. So that's really important. So we've designed a really diverse engagement program to identify these priorities with the community and provide a social vision that is representative, truly representative of what the community issues and priorities are. In so doing, we can then align our strategy and our outcomes to get a really effective social strategy going forward. Because we recognise that a really good community strategy is one that aligns with an organisational's goals and importantly aligns with members, in this case the community, their needs. And in that way we'll keep engagement high and also provide a return on investment. So that's our view as we go towards this design period. So these are just a couple of examples just to show you the very few of the multiple spectrum of ways you can measure. Showing here things like the Thriving Cities Index. Ontario is doing some great things as well. Derbyshire County Council, City of Greater Geelong as well, all have a range of ways that we're examining that we might best look towards structuring our strategy so we can measure social impact. We're also really interested in the role of social capital, and that's because social capital is known to contribute positively to physical and mental health, and also perceptions of subjective well-being, and also enhance sustainable development outcomes, contributes to community resilience. And places with strong social networks can also facilitate greater innovation. So that also helps to have a diverse economy. And so that cycle of economy and that relationship with community continues to grow and has that feedback loop, importantly. So we're examining the role of social capital as well. I mentioned before about the role of council. So one of the things in our design phase that we're looking at the moment is determining our materiality. So, you know, what are the priority issues in the community and what is council's role? So what I'm showing you here is a materiality matrix, and on the left is the degree of importance to stakeholders. What I have plotted there is a range of community issues that I've aggregated up. So things like health and wellbeing, housing affordability and homelessness, transport, community recovery from disaster, social equity and inclusion. And on the bottom axis, it's council's ability to control or influence. And it goes from direct control to no influence down here as well. There's a number of reasons for this. It's not only to represent, I suppose, council's role in that and communicate it to our councils, but also the community. We often find when we go out for community engagement that people might speak about issues of transport infrastructure or housing. And the challenge for us is, whilst it's a problem for the community and we recognise that, we have a challenge in that we're not the lead agency in that space, so we need to see where we sit and fit. So this helps us to communicate where we have influence. So we have some influence here in those areas such as transport and housing, and that's really useful for us as well. But the degree of importance is what we're going to be going out to the community with. We're going to be asking them questions. How important is this issue to you? What are the priorities? So that's going to be really important, that it is actually generated, that feedback and insight is generated from the community. And that's underpinned by quite a significant analysis of the range of players to understand council's role. So things like, what do federal government, state government, local government, community organisations, and indeed citizens, what role do they play and what do they contribute? Because people can be the lead agency in policy, but the funding provision may come from other places, or the service delivery comes from other places. So we need to know all of the pieces of the puzzle so we can put it together and learn where we might best fit. And from there, the next stage of the design journey is to progress into a theory of change, which Mel talked about earlier. So we'll be looking at those inputs and our activities, the stakeholders which we would have established, and look at some of the long-term outcomes and the short, medium and medium-term outcomes as well. And so I guess the big questions for us in going through this process is, what is local government's role in building social capital? And what do we want our next social strategy to do? And then from that, how can we best measure outcomes?